Hi, my name is Andres Acosta from the Division of Gastroenterology and Hepatology at Mayo Clinic. On behalf of our co-authors, I want to thank you for your interest in our paper, Quantitative Gastrointestinal and Psychological Traits Associated with Obesity and Response to Weight Loss Therapy, which will be published in the March issue of Gastroenterology. Our manuscript is divided in three parts. First, we identified gastrointestinal and behavioral traits associated with obesity. Then, we were able to subclassify obesity based on gastrointestinal and behavioral traits. And third, we validated these physiological traits as predictors of weight loss in response to pharmacotherapy for obesity. Here are the details about our study. As you all know, obesity is this century epidemic and its prevalence continues to increase worldwide. Despite of advances in the understanding of obesity pathophysiology, weight loss with current non-surgical treatments, including diet, exercise, and medications, is highly variable. Additionally, little is known about quantitative gastrointestinal traits that predispose to weight gain and predict weight loss in response to non-surgical therapy. Our aims were to examine the association of quantitative gastrointestinal and psychological traits with BMI and waist circumference, to identify latent dimensions in obesity, and to validate the use of quantitative traits in predicting response to a specific pharmacotherapeutic agent approved for treatment of obesity. We studied 509 adults, normal weight, overweight, with obesity class 1, 2, or 3. Participants had no other medical problems. In the clinical research unit, we performed the following studies. We studied satiation by a nutrient drink test. This test consists on consuming a constant rate of liquid drink until you reach maximal satiation or fullness. We found that obese individuals consume more calories prior to reaching usual satiation when compared to normal weight individuals. We tested satiety by giving a standard breakfast followed by a buffet meal at lunch. We identified that individuals with obesity and abnormal waist circumference ate more calories than individuals with normal waist circumference. Then we studied gastric emptying of solids and liquids by scintigraphy and found that obese individuals have an accelerated gastric emptying of solids and liquids. Then we studied the effect of gastric volume and found that obese individuals have a larger fasting gastric volume. And we tested gastrointestinal hormones by ELISA and found that obese individuals have lower concentration of peptide YY. Finally, our participants completed behavioral and physical activity questionnaires, and we found that obese individuals have higher levels of anxiety, depression, and are less physically active. With these results, we did a principal component analysis to identify possible latent dimensions in obesity. Our findings account for approximately 81% of the obesity variation. The most important latent dimensions were satiety 21%, gastric capacity 14%, psychological 13%, gastric motor and sensory functions 11%. Then, to prove our subclassification of obesity, we performed a randomized placebo-controlled trial with phentermine topiramate extended release. There were no adverse effects reported in either treatment group. Phentermine topiramate extended release resulted in a decrease of 206 calories when compared with the placebo group in the satiety test and significantly delayed gastric emptying. After 2 weeks of treatment, patients on phentermine topiramate extended release lost 1.4 kilograms when compared to patients on placebo who lost only 0.2 kilograms. Subsequently, we analyzed whether baseline gastrointestinal traits will predict response, and we identified that a baseline satiety test in individuals weighed over 900 kilocalories predicts better response to treatment than in those weighed less 900 calories. In conclusion, obesity is associated with a decreased satiation, accelerated gastric emptying, increased fasting gastric volume, and decreased postprandial peptide YY, all of which can individually be associated with an increased caloric intake and predispose to or perpetrate obesity. Our current study does not discriminate between cause or consequence of obesity. It suggests phenotypic subgroups can be identified based on pathophysiological mechanism. Thank you for your interest in our study, and I hope you enjoy reading our manuscript.